Hi everyone, I'm Dr. Sarita Jain. Today we are going to talk about spirometry. This is a vital tool that can play an important role in improving post-operative outcomes for patients undergoing surgery like cesarean sections, hysterectomies, and even minimally invasive procedures such as laparoscopic and hysteroscopic surgeries. We'll discuss how spirometry works, why it's useful pre and post surgery, and how it benefits patients in both the short and long term. So, first of all, what is spirometry? In simple terms, spirometry is a test that measures how well you can breathe in and out. It checks your lung functions by measuring two main things. First is forced vital capacity. This is the maximum amount of air you can blow out after a deep breath. Second is forced expiratory volume in 1 second. This is the amount of air you can exhale in first second. This test is not only easy to perform but can give us important information about respiratory health before and after surgery. Before any surgery, particularly if you have underlying respiratory conditions like asthma, chronic bronchitis, or you are a smoker, spirometry can help to assess your lung function. During procedures like laparoscopic ovarian cyst removal, hysterectomies, or other gynec surgery, we often use carbon dioxide to inflate the abdomen for better visibility. This gas can put pressure on the diaphragm and lungs, makes it difficult to breathe during and after surgery. Preoperative spirometry helps identify patients at risk for postoperative respiratory complications so that we can take preventive measures. Many cesarean patients, especially those who are obese or have respiratory conditions, they can be at risk of developing lung problems like atelectasis. Preoperative spirometry allows to evaluate the lung function and take necessary steps before surgery. Knowing the lung function preoperatively allows doctors to adjust anesthesia and post-op care and ensures safer outcome. After any surgery, especially gynecological or abdominal surgery, patients tend to breathe shallow due to pain or discomfort, which can lead to complications such as atelectasis, which is partial collapse of lung, respiratory infections like pneumonia. By using an incentive spirometer, we can prevent these complications by keeping lung expanded and by mobilizing secretions to avoid infections, and this helps patients recover faster by improving lung functions. Many patients may think that recovery from minimally invasive surgeries like laparoscopic hysterectomies or ovarian cyst removal is easy since the incisions are small. However, because CO2 is used to inflate the abdomen, the gas can irritate the diaphragm and cause shoulder pain or discomfort in breathing postoperatively. Incentive spirometry helps clear this gas faster, makes breathing easier, and reduces discomfort. Now, how to perform spirometry? During this test, patient is asked to take a deep breath and blow as hard as possible into a small handheld device which is called spirometer. This is done multiple times to get an accurate reading. This helps re-expand the lung and prevent complications. This is a simple test that can be done at home after discharge also. There are different types of spirometers that we can use based on the situation. First is diagnostic spirometers. These are more advanced machines used in clinics to diagnose lung conditions and assess respiratory health. Next is incentive spirometer. These are most common post-operative devices we give to the patients to help with deep breathing exercises. Next is portable spirometer. These are small handheld devices that can be used at home to monitor lung functions during recovery. For post-operative patients, incentive spirometry is particularly useful and easy to use. And now, what are the risks and complications of spirometry? Spirometry is a safe procedure with very minimal risk. However, while using it, few things should be kept in mind. Some patients may feel a bit lightheaded or short of breath during the test, especially if they have existing lung issues. In post-operative patients like cesarean or hysterectomized patients, they might feel some discomfort due to abdominal pain, especially when performing deep breathing exercises with an incentive spirometer. But this can be managed with proper support and pain relief. Now question is, should you use spirometry for all patients after surgery? After minimally invasive surgeries like laparoscopic ovarian cyst removal or hysterectomies, spirometry is still beneficial. Even though these are small surgeries, they can still affect lung due to the use of CO2. Using incentive spirometry post-operatively can speed up recovery by improving lung function and clearing the diaphragm of any trapped gases. Post-operative spirometry is especially important in cesarean and hysterectomized patients to prevent respiratory complications and to speed up recovery, particularly for those who may stay in bed for longer duration. If you are considering incorporating spirometry in your post-op care, the answer is yes. Whether it's a cesarean, hysterectomy or laparoscopic procedure, spirometry can significantly improve lung functions. It reduces the post-operative complication and ensures quicker recovery. So, by incorporating spirometry both pre-operatively and post-operatively into your surgical care routine, whether it's for cesarean section, laparoscopic or hysteroscopic surgery, it can provide significant benefits. It is a simple, non-invasive tool that helps in reducing complications, speeds up recovery and ensures better outcome for your patients. Always remember, spirometry help in faster recovery, keeping lungs healthy and strong. Even if the surgery was minimally invasive, spirometry can make a big difference. Including spirometry in post-op care is a small step that can lead to big improvement in patient's outcome, whether you are performing a cesarean section or a laparoscopic procedure. By incorporating spirometry into your patient care, you will be ensuring not only smoother recovery but also fewer complications and happier, healthier patients. Thank you.